Okay. Welcome, everyone. Lots of people are still connecting here to the audio. Welcome all to the second session of the GAP Organized Global Lead Forum. Today's session will be focused on lead exposure in cookware. My name is Rachel Kupka. I'm the Executive Director of the Global Alliance on Health and Pollution, and really pleased to have you all here today. For those of you who are joining us for the first time, the Global Lead Forum was created as a platform really to be able to bring together a wide range of actors who are really typically siloed from each other. So the academics doing their thing over here, and the donors over here, and the ministries of health and environment over here, the UN, other professional organizations, NGOs, all doing their different things around lead. So we're trying to bring you all here together to really talk about lead and really provide this virtual space for knowledge exchange from just everyone who's got such a wide variety of expertise and backgrounds and different bits and pieces that they're working on here. So the forum, of course, is convened by the Global Alliance on Health and Pollution. We are a Geneva-based network of about 65 or more international and national agencies really committed to working on developing a response to the global pollution crisis and its impacts on health and the environment and economics and all sorts of other negative impacts. And we were really formed actually 10 years ago, almost to the week, to really look at how we can best respond to this issue of pollution in a very collaborative, multi-stakeholder way. And that type of approach is really necessary and critical if we're going to have an impact at any time in the near future. Our Global Lead Forum is funded by GiveWell, and this is a part of the Protecting Every Child's Potential, which is organized by Pure Earth, UNICEF, and the Clarios Foundation, and has lots of new partners there. So there's a nice website that you can check out that partnership. Some housekeeping before we go. The session is being recorded. We have automatic live captioning available. If you have any questions on how to do that, please just send a message in the chat box. Please keep your cameras on if you can. It's really good to see all of your faces. And we won't judge you, we promise. If you're eating lunch, it's quite okay. Keep your microphones on mute though. We will have a Q&A at the end, so I will be moderating that. So please put your questions into that chat box throughout, and we'll keep track of those things. So now we'll move over to our presenters. It's really our pleasure to host today a distinguished number of panelists. First, we have Rich Fuller from Pure Earth. He is the president there. He's also the founder and past chair of the Global Alliance on Health and Pollution. He's really an environmentalist at heart, having founded both Pure Earth and GAP, as well as a sustainability consultancy company called Great Forest. He's also really well known as the convener and co-author of the groundbreaking 2017 Lancet Commission on Pollution and Health, and the update of which just came out in May. So if you haven't seen that, we'll also be sure to pass that information on. So Rich, over to you.
Thank you, Rachel. Nice to see you all here. I just like at the beginning of these events to give a little bit of the background on why we need to focus on lead. Could I just raise my hand when we have a slide to move forward like this? Will that do it? Who's running the slides? Anyone got the slide controls there?
Yes.
Arantxa, could you move the slides forward when I lift my hand?
Absolutely.
Okay, we'll just wait for the next slide here. So as you know, lead poisoning is a serious issue in low and middle income countries, and it's been well documented. Could we go to the next slide, please? When I raise my hand, is that okay? Thank you. Thank you kindly. It's been really well documented in The Toxic Truth, which I recommend to all of you, which we put out in 2020, that Pure Earth put out in 2020. And it shows that low and middle income countries are severely impacted by lead, to the extent that 1 in 3 children are currently lead poisoned. And with that, there are damages that occur to that population that extend throughout their lives. it makes lead clearly the most significant exposure of any chemical out there. It's far in advance of pesticides, of PFAS, of any other toxin that's out there, because the damage that it does to the developing brain has long-term implications for lifetime earnings because of loss of IQ, for learning capacity. There's a year of life, there's a year of educational attainment that's lost, and for other implications that I'll show you just very briefly here. The loss of intellectual capacity has an economic cost, where the number of people who are capable of being academicians or leading a country forward is severely reduced because of this overall impact in intelligence. And that can be equated to as much as 4% of GDP, according to the World Bank numbers. 4% of GDP, because we've damaged these children's brains and they're not as productive as they ought to be. There's also a strong association between these populations and increases in violent crime, and some more work's being done on that that's very interesting. So fixing this problem has enormous implications throughout all aspects of society. And we also know that it's actually getting worse as time goes on. The main exposures out there are from these three different issues. I'm looking forward to seeing good descriptions on programs and opportunities in cookware. And I think I will stop from here and let it pass on to our first presenter, my dear friend, Dr. Paramita Hore. Should I just let you jump straight in?
Sure, I'll just give the quickest introduction. So Dr. Paramita Hore comes to us from the New York City Department of Health and Mental Hygiene, where she's been working for quite some time on a variety of different issues. She provides a lot of technical assistance to the Bureau on issues related to environmental exposures, environmental sampling analysis, and she oversees the Bureau's investigations on hazardous consumer products, including pottery, which we'll see here today. So these investigations that she has led have resulted in thousands of lead-contaminated consumer products from New York City businesses being removed from the shelves. So please, over to you, Dr. Hore.
Thank you so much, Rachel and Rich. It really is a pleasure to speak to everyone here today. Let me check on time. So next slide, please. To the audience out there, good morning, good afternoon, good evening, based on wherever you are. And again, very excited for GAP, and thanks for coordinating such a meeting. It really is a great opportunity to share information amongst our global partners. Next slide, please. So today I'm going to talk a bit about our experience in New York City around lead-containing ceramic ware. How we identify such products and what we have done to address the issue within the city. Before I delve into that, a little background of blood lead surveillance in the city. In New York City, blood lead testing is required for certain groups by law. Young children at the ages of 1 and 2 are required to be given a blood lead test by their provider, and children up to ages 6 are required to be assessed for lead risk factors and given a test. At-risk pregnant individuals, as well as workers with elevated lead exposures, are also required to be monitored for blood lead. And we at the New York City Health Department, we get all of the blood lead results for all New York City residents that get tested. And this amounts to hundreds of thousands of blood lead test results annually. And we have protocols in place to conduct follow-up investigations of individuals with elevated blood lead levels. And part of the follow-up entails administration of a risk assessment questionnaire. Essentially, we interview the cases or the families to determine lead risk factors for the individual. And during the interview process, we ask about consumer product use, what they may be using for health, or foods or spices or cultural purposes or cookware. And we do collect samples when deemed necessary for lead testing. And we also in New York City conduct routine surveillance of New York City stores looking for availability of lead-containing hazardous consumer products as identified during the case investigations. And through such investigations, we have identified a variety of lead-containing consumer products. These include certain health remedies or foods or spices, cultural powders, religious powders, as well as cookware. And you can definitely find out more information on our website, which is actually www.nyc.gov/hazardous products. But today I'm going to focus on the ceramic ware that we have found through these investigations, found to contain extremely high levels of lead as well as associated with elevated blood lead levels. Next slide, please. Thanks. So traditional ceramic ware can contain high levels of lead, and the glazing or paint this may be added for aesthetic purposes or for moisture protection or moisture control. And the lead used on the ceramic ware can transfer onto the foods or drinks that are prepared, stored, or served in these products. And we in the city have seen numerous cases of lead poisonings in both children and adults associated with the use of these types of ceramic ware for a variety of purposes, cooking, drinking on a daily basis. And we've seen cases associated with ceramic ware products from various parts of the world. Some include Ecuador, Uzbekistan, Mexico, Turkey, Japan, Morocco, and even products that cases reported that they purchased in New York City. Next slide, please. And we actually continue to see lead poisoning cases associated with use of ceramic ware from Mexico. We recently published a report regarding a family of 5 that had a elevated blood lead levels. And this is a family of 5 that included the mom, the dad, and 3 children. And they had blood lead levels as high as 53 microgram per deciliter. And the family was using this ceramic pot. It's the picture of the pot that they obtained in Mexico. And they were using it for cooking, storing meals, preparing coffee. Next slide, please. Although many of our lead poison cases report they may have purchased or obtained such lead-containing ceramic ware in their home countries during travel, we have found that these types of products are also available for sale in New York City stores with lead levels thousands of times higher than the federal standards, the US Food and Drug Administration lead standards. Next slide, please. We do take enforcement actions locally to stop New York City businesses from selling hazardous consumer products such as this. And in the past 5 years, enforcement actions taken by the City Health Department has resulted in removal of over 6,000 ceramic ware units. Enforcement activities are ongoing. We have also notified the federal agency, the US Food and Drug Administration, of our findings, particularly our distributor findings. And this has triggered US FDA investigation. We've informed the National Institute of Public Health in Mexico of the issue in New York City and are continuing discussions of long-term strategies perhaps we can come up with for addressing such an issue. And then we are getting ready to update our Consulate General of Mexico in New York City of the issue or our findings in New York City. Next slide, please. We will continue the surveillance activities through the blood lead testing as well as the store surveys. We also continue our education and outreach activities to raise awareness amongst our at-risk communities within New York City. Next slide, please. However, there will continue to be challenges around informal distribution of such products when people travel abroad or hand carry these products, say from countries where these products are not regulated. There's also resistance for behavior change associated with use of such culturally ingrained products. So ultimately, really, the source control is the solution. Eliminating the use of lead in ceramic glazes is necessary and critical, and something for the global community to work towards. Last slide, please. Again, I refer you to our website. We have a lot of data around our product testing on our website. It is accessible via www.nyc.gov/lead. And feel free to reach out to me. My email address is at the bottom of the screen. I thank you again for the time and this opportunity to present today.
Thank you, Dr. Horie. It's really interesting to see that case example and quite astonishing at how high the blood leads were from this consistent use. So thank you for presenting that. Next up, we have Dr. Angela Matthey, the Chief Specialist Scientist in the Environmental and Health Research Unit of the South African Medical Research Council. She holds a master's degree in environmental epidemiology and policy from London School of Hygiene and Tropical Medicine, and a PhD in public health from the University of Witwatersrand. At the Medical Council, she is working on areas of research related to lead exposure in African children, housing, health, and societal adaptation to climate change. And during the pandemic, she was involved with the development of wastewater-based early warning systems for COVID transmission. She's also a visiting professor at the University of Johannesburg and an associate professor at the University of Witwatersrand. So please, Dr. Matthey, over to you.
Thanks very much, Rachel, and good evening to everyone from South Africa, where we have a very wide range of sources of exposure to lead, particularly in the informal sector. And today I'll be talking specifically about artisanal cookware, aluminium cookware, and how that is becoming a source of exposure increasingly, and one that we haven't been aware of until very recently. The next slide, please. So we discovered the use of these artisanal aluminium pots quite inadvertently, just driving by an informal street trader and noticing that the color was different to the traditional cast iron three-legged pots that had this black protective coating. So that just sparked a couple of conversations with people, with the street traders themselves, and then doing a literature search and finding that a similar occurrence in Cameroon and other parts of Africa and Asia. And so we started a few small-scale investigations in various parts of the country. The next slide, please. And what we found was that the practice had been around on a very small scale and in a very specific part, the northern parts of the country, for decades, since the 1980s. But that in recent years, there's just been an explosion in the production of these pots and their transport. So we have 9 provinces in South Africa, and they're now available in at least 7 of those provinces. And there's very little research on the pots as a source of exposure and the lead exposure in users of these pots. Next slide. And this slide just shows some of the sources of exposure. People use aluminium waste from appliances, from motor vehicle car parts, engines, wheels, etc. And those get melted down to make these pots. The next slide. And here is, you see one of the very, very basic furnaces. It's really just an old drum in which people make a wood or coal fire and then melt these products down. And these little artisanal pot factories are usually on residential sites. They're very, very crude. They make earthenware molds to craft pots. The artisans use no protective gear at all. They usually happen either as two men making a pot or in a small cooperative of about 6 manufacturers. And we could see a lot of residential and environmental contamination from the waste, the ash that's produced in the process. The next slide, please. And here you see some photo images from the pot production process. I'm not sure why all the images are not appearing, but here you can see the molten metal, and that's what the earthenware mold looks like. Here you can see the burning area for these scrap metals, and you can see there's no separation or division. So these areas are very easily accessible to children who actually play right inside these places. The next slide, please. I'm not seeing anything. Oh, there we go. And I just wanted to show this slide to show you how much waste gets collected. In this instance, it's a big ash heap, but people also dispose of the waste into nearby streams. And obviously, there's a broader environmental contamination concern as a result of that practice. The next slide, please. At the end of the pot making process, most of the pot makers take silver paint from a can like this or a spray can and spray or coat the pot in that silver color, which is another a cause for concern, because people tell us, you know, that when the first time when they cook in those pots, the food, mostly it's a maize meal or pup as they call it here, that first meal is coated with the silver paint, and people don't tend not to wash it out before they use it for the first time. So there's that additional source of exposure for first-time users. The next slide, please. And so what we did was cut pieces of the pot, and we took it to our partners in Austria and just boiled the pieces in a 4% acetic acid and then measured the concentrations of lead in the leachate. We also looked at the pot pieces after each boiling to look at the surface of the pot, and I'll show you some photographs of that in a moment. The next slide, please. Here you see how variable. The two things to notice here is how these are 20 pots, and you see they vary. The concentrations of lead in the leachate varied quite significantly across the 20. That, I'm assuming, is related to whatever was in the molten metal used to craft the pots. And then you can also see how they vary from one boiling to the next. The emission of lead would vary quite dramatically. The next slide, please. Here you can also see the visible residue after we boiled the metal in the 4% acetic acid. The next slide, please. And this is what it looked like, the electron microscope images from a new pot. And you can see how the surface gets denatured or disrupted after leaching for the first time. The next slide, please. We also did a quick little study in which at 6 foundry sites, we took a ghost wipe and wiped the hands of the pot makers before and after. And we could see a 3-fold increase in the concentration of lead on the hands of those workers. The next slide, please. So in terms of policy and intervention, I think this is going to be a particular challenge because people really hold these items with a sense of pride. Households have their family surname on the pots. And schools, you can see here, the schools mark their pots similarly. Some families have an emblem or some piece of artwork crafted onto the pots, and it's seen as a pride, a possession of which people are very proud in the community. The next slide, please. So by way here, these photographs just show the scale at which these pots are now being produced, either imported from neighboring Mozambique or manufactured in South Africa and then transported en masse to urban areas, other provinces, and then sold either in markets or by street vendors. And here you can see this, these all have clearly been coated with that silver paint. So at this stage, we know that lead emission is definitely occurring. We know that the pots are widely available in the country. We also know that for certain communities, especially in the affected areas, that the exposure to lead is potentially pervasive, because these pots are being used by households to cook the daily meals. They're being used in schools to supply children with food as part of the school feeding schemes. They also, it's the only pot being used in street markets, and they're also being used at celebrations, at funerals, weddings, etc. So it's almost inescapable, the use or the consumption of food cooked in these pots. So it's a real socioeconomic dilemma for households. You know, it's a matter of livelihood. As one father said to me, please don't tell us that these cooking in these pots harms our children, because without this as an income, my family doesn't eat. So it's a real deep socioeconomic dilemma and generation of livelihoods issue for these households. There are also risks for the pot makers. Many of them showed us scars from burns from using the molten or handling molten lead. Primary prevention is going to be key, but without addressing that socioeconomic dilemma, it is very hard to see how we're going to actually help these people. The next slide, please. These are just some of the articles that we've written. Sadly, our research has come to a standstill because of COVID-19. We've had to shift our resources and our attention to the pandemic, but we hope to kickstart some of the studies again in this year or early next year. The next slide, please. Yeah, that's it. Thanks very much for your attention.
Great. Thank you, Dr. Mathie. It's really incredible to see this problem popping up and the real level of variation of the leaching of the lead from these pots. It must complicate the analysis quite a bit. So much appreciation to your hard work on this. I see people are starting to use the chat box. Please do continue to do so, so that we can keep track of your questions as we go. Next, I'm very pleased to introduce Dr. José Antonio Menezes Filho from the Federal University of Bahia, Brazil. He's a professor there and has his background in pharmacy and environmental and public health. His research interests are around the impact of environmental pollutants on human health, and especially toxic metals, pesticides, and persistent organic pollutants. He's also interested in evaluating food contaminants like metals, mycotoxins, and organic byproducts and their effects. He's published quite profusely and is a guest editor on a special issue of the IJERPH, which I can't even begin to tell you what that stands for. So my apologies, Doctor. He's also a principal investigator on a birth cohort study and aiming to investigate the social and environmental determinants of children's neurodevelopment at a year of age in Bahia. So that's incredibly interesting, and I'm sure we'll hear about that work at another time. But for now, looking forward to hearing your presentation. Over to you, Dr. Menezes Filho. I don't think we can hear you. I can anyone, no, we're having some sound problems. No, I'm sorry, sir, we can't hear you still.
Are you hearing me now?
Yes, much better. Great. Excellent. Thank you. Please go ahead.
Oh, now I can't hear you.
We can hear you. Go ahead. We can hear you.
Okay, now, yes, now because I was not hearing you. So, okay, good morning, good afternoon, and good evening, everyone. Well, thank you, Laura, and the organized committee for inviting me to share our finds here in this forum. I'm really honored. As the term of my presentation says, I'm bringing some data on exposure through lead glazed ceramics in Bahia, Brazil. Next, please. Well, here, I'm specifically talking about the village of Maragogipium. That's the only site in Brazil that uses this lead glazing process. Okay, and this they have a population about 3,000 inhabitants, almost 200 potteries workshops over there. So they produce lots of clay products and utensils that serve them to use to cook and save food. So this lead glaze process is still used about 20% of those pottery workshops. And this is where this is located, about in the region. It's about around Todos os Santos Bay. This is the state capital of Salvador. It's about 1 hour and a half from there. So we have to work there, to travel this distance to engage with the community. So we have some to serve some food here and the workshops over there, and where they sell these products as well. Next slide. I first learned about this serious situation was around 2013, when the doctoral student, Manuel Chagas, invited me to be part in his thesis committee. And well, as you can see here, he applied some standard method to study lead migration from, so you see the pots are over here and he tested. So he had found level about 5,000 milligram a liter, different from the Dr. Angela found there in South Africa, that was about micrograms per liter. Here we found 5,000 milligram per liter. So the migration was very high. They're not homogeneous. And also, he studied Merrill's migration for non-glazed potteries. You see here on the other side. Can you next, please? So we have a small, exactly. And then with another backward, please, just a little bit, if you can go. Go backward, please, Rachel. Yeah, because yeah, you see that only in these two communities, in Maragogipium, they have this background level, about 0.19 milligram per liter, and in Vitoria also a very high, very moderate concentration from potteries. Next, please. So how they obtain this? The exposure there from the artisan are very high. Next, because they have some animation. You can go next. You see the exposure artisan is critical due to the rudimentary lead oxide production. Next, please. I have some image that pops up. Yeah, thank you. They obtain it by melting lead batteries, and after the 2 hours, they are turned into this yellowish powder over here. And so they use these powders and make it next. They prepare a mix with clay. Can you pull next slide, please? Not the slide, but yes. So they have this mix they apply to the interior part. Next, please. Then again, please, next. Move. Okay, they have to obtain this glaze. Okay, also one more image. broken parts and scraps are dumped into the river, so they have this contamination in the, so the soil in those workshops and around the cereal is contaminated. Okay, thank you. One more, please. Next slide. So I started the exposure there with studying the environmental contamination. So in 2016, I supervised the master's dissertation of the Renata Guerreiro in Food Science program. We checked the environmental contamination by analyzing tissues of the mangrove root crab. Can you please, next image? Yes, so you can see here the mangrove root crab. And also we checked in this 1 kilo pack of muscle tissue. And then we also checked lead concentration in the stew prepared in those cookware. So we found increased concentrations of lead in the gills, not in the muscle tissue, but then in this package of the tissue, we found a significant concentration. Then in the stew prepared, the concentration was much higher. Okay, and so next, please. And then we found in the gills of the crab, 0.70 milligram per kilograms, different from the tissue that was not detected. So we published, next slide, please. So increased the lead level contamination food cooked in lead glazed ceramic pots. We published a paper that showed, next, please. We showed a paper that most lead levels augmented significant along with the food processing. The level surpassed the Brazilian international safety limit. We can move to the next slide, please, Rachel. Yes, next, please. Well then, and I supervise also the master's dissertation of Ferrer Alba, in the graduate program in pharmacy. So we investigate children's exposure and some hematological parameters. We evaluated how children are exposed. We measure some environmental markers like the subtle dust we collected at homes and at schools that children used to go. Can you move the next image, please? And also we assessed the blood lead levels and also the activity of the enzyme aldehyde dehydrogenase. We collect sample of 150 children aged 5 to 13 years. So we divide them 75 from on this area here. You can see the two spots. That's the bottom part of the figure show they are on the river where most of the pottery workshops are located. So this area is more contaminated than the other part that was more square red here. That's some schools, 2 schools here that's less exposed. We compared with other 75 children that lived in the urban center. So then we had this result. Can you please next table? There's a table. Then we have some image. And so, can you move one bit more, Rachel, please? So we found lead deposition rates at school near pottery workshop 3 times higher than the rates observed in schools in the reference area. So the lead dust deposition rates are about 3 times higher. And also next, the average rate at the homes near the pottery workshop was more than 4 times higher. And about the blood lead levels, you can see over there, they're significantly higher in Maracaju Pinho than compared to the control group. So the prevalence of elevated blood level, please, one more. So it's about 15% of children in this area more contaminated, they had elevated blood lead levels. Please, one more image. Okay, and then we can move on. Next, please. And also found that a significantly correlated, that the activity of the enzyme was significantly correlated with the blood lead levels, and so was the ferritin levels over there. Okay, next slide, please. So we published this paper that showed this association. And so next slide, Rachel. I can move on. So we implemented some risk communication strategies. So we set up some meetings with the artisans, community and stakeholders to explain the toxicity of lead toxicity. We return also lab results with proper explanations. And with the collaboration of Pure Earth, we organize a workshop to train the potteries with a lead glazing process, or lead-free glazing process. As you can see in the image there, you can see Danielle that is present here with Vito that from Pure Earth from Barro Puro, Fundación Barro Puro, Mexico. So they had a nice experience. We exchanged a lot. So also we strive to find a self-sustaining lead-free glazing process. Next slide. In conclusion, production of lead glazed ceramic cookware is still in continuation over there, here in Maracaju Pinho. And there's significant exposure of artisans and their children to lead. Those data, they're not present, but we have some data on occupational exposure. A restaurant that serve typical Bahia food continue to use such pots and pans. I myself, just another day went to my restaurant and was served with some stews in these pots, you know. A sustainable glazing substitute was not made possible, though we sought some support from the government of Bahia Handicraft Development Secretariat. And a birth cohort is being carried out in the region to assess these and other exposures that may affect children's neurodevelopment. We call this project, this study is called Design 12M. And next, please, and the last one. And I'd like to thank everybody. Thank for this important forum, address this issue that's commonly neglected in developed countries. Thank you very much.
Muito obrigada. Thank you very much, Dr. Menezes Filho. This is a really interesting example, and I was actually really struck by the slide showing the life cycle from the origins of the lead in the unsound recycling of the ULAB, the batteries, and going all the way through. You know, this is interesting, pointing out that ULABs, used lead acid batteries, are really an easy source of lead for many artisanal operations, from cookware to ammunition to other things. Next, we have up Daniel Estrada, who's the director of Pure Earth Mexico. His background is in electrical engineering, and he has more than 2 decades of experience in community-based projects in the nonprofit sector. He's been working on environmental restoration, environmental health, pollution mitigation, and at Pure Earth, responsible for the Barro Aprobado project, which which he'll talk to us a little bit about now, on how to remove lead from traditional ceramics industry in Mexico. He's also well published on this work. So thank you, Daniel, over to you.
Thank you very much, Rachel. Thank you very much to GAP, to all of the guest speakers, and of course to everyone listening to this either live or recorded. Thank you very much for being here. So I'm going to talk about the lead program that we have in Mexico as part of Pure Earth. As Palomira mentioned, the most important thing is to solve the problem at the source. The source control is fundamental. Maybe some of the pots that she mentioned that went to New York, maybe they were produced around here where I am. I'm in Morelos, and I'm very close to one of the main axes of pottery production in Mexico. So I would like to start with the next slide, where we can see why we are going to talk about pottery and about blood lead levels. As you can see here, we have the 32 states of Mexico with their blood lead levels. It's not the blood lead level, it's not micrograms per deciliter, but it's the percentage of children that have blood lead levels above 5 micrograms per deciliter. So we can see at the right-hand side, Puebla is the most affected state, with 46.6% of the children considered to be intoxicated by lead. This is considering a blood lead level above 5 micrograms per deciliter, which means that there are more children affected, because as we know, there's no safe level for lead. But you can see this is really a big problem in Mexico. the media, the average blood level in Mexico, or the average of children that are above 5 is 17%, which is huge. And the most important source that we find for this exposure to lead is pottery. Some of the pottery goes to New York, unfortunately, Paramedia, so we want to control this, but we, as Mexicans, we are really proud of pottery. We love to see the nice, shiny glasses, vases, pots to prepare mole, rice, coffee. So we don't want to go against tradition, we just want to go in favor of removing lead from pottery. In Brazil, they have one town that is affected by pottery. Here in Mexico, we have between around 10,000 different workshops in 20 states. So what can we do about it? Next slide, please. Pure Earth has been working in Mexico since 2009. Since then, a lot of advances have been done. We still need many more things to do, but today I wanted to share you some of the examples of the things that we have been doing. I'm going to talk just about 4 projects. We have more, but I consider this to be the most significant. So it's Barro Aprobado, it's the Circle of Women, it's the Pottery First, and it's the Lead Free Food Alliance. In the picture, we can see a potter preparing this is just molds. This is not going to be used for food, but she's preparing pottery. And by her side, we can see people from Clarios Foundation. They are our funding partner for this project. So I'm going to start with the Barro Aprobado project. The next slide, please. If you go to any market in Mexico City, you will find a lot of pots, a lot of nice, shiny glasses and cups for coffee and dishes and different things. Maybe 99% of these pots are going to have lead. So how do we know that they have lead? We use a very quick system to find out if it has lead. What we have here is sodium rhodisonate. We mix it with a little vinegar, and then we put this mix in a cotton swab. So this is the color of the mix. This is vinegar with sodium rhodisonate. So we have to test the pot that we want to see. So let's find out if this one has lead or not. If it turns red, it has lead. So you can tell me if this has lead or not. It's shiny red. Most of the pottery in Mexico is shiny red. It is hard for people to go around the markets just swabbing the pieces. Most often, this pottery is going to have lead. So what we do is that we go with the potters that use lead-free pottery, as in Maragón y Piño. We give them a training, we follow up, we make sure that they know how to use this glaze. Once they stop using lead oxide as a glaze, then we can remediate their workshops, and we give them a seal. This is the seal that we give. It says lead-free, it says Barro Aprobado, and it has the initials of the state, of the community, and of the potters. So this way it is traceable. We can know who has produced this type of pottery. So we know, for example, that this pot was produced in Morelos. It's the state where I'm right now. It was produced in Tlayacapan, and it was made by the Familia Dorantes. So if we find this piece of pottery and we realize that it has lead, then we know exactly who should we knock on the door. So it will be the Familia Dorantes. Actually, Doña Rosario was the potter that appeared on the previous picture. So what we do with Barro Aprobado is that we are looking for 3 main things. One of them, we want to have lead-free potters. Next, we want to have lead-free stores. We want stores to be to have lead-free pottery so that consumers can go there and buy lead-free pottery. And third, we want lead-free restaurants. The idea is for people can go and buy their food in a restaurant and make sure that it is lead-free. So the Barro Aprobado program is like the main program that we have in Mexico. And the idea is to do source control of the pottery. As I told you, it's around 10,000 pottery sites. we are working mainly with communities in Puebla, which is the most affected area. And if we can go to the next slide, we can see one of the cases that for me is more significant, and for Pure Earth in general, it's really interesting. And it's the circles of women. Basically, we have been teaching potters to switch from lead oxide to lead-free glaze. And we had trainings where we had potters all mixed, and we gave the training on how to use lead-free. And then about 7 or 10% of the potters decided to go lead-free. With Circle of Women, it's kind of different. We don't give only the training on lead-free glaze. We give different trainings, and we generate a space for women. As you might know, Mexico is a macho culture, and women were left aside from having a space for their own. There are space only for men, but there were no space only for women. So we generated these spaces, and it's really interesting how women communicate, and they turn out to, right now, they want to change in a 100%. That's something that we have never seen. But all of the women in the Circle of Women, all of them want to change, and they want to make all of their pottery lead-free, which is really interesting. We also work with certain communities that don't produce glaze pottery. It is the Bornish pottery, which is really nice, or the natural pottery. This is lead-free. But we also promote that type of pottery, and we also work with Circles of Women. Here we can see how the women are building the kilns, and this is something that was only for like a man activity. So now they are going further, and this is something that is really interesting for us, because our impact goes beyond health. It also affects culture, and that we are empowering women, which makes us very proud. And we have also, we need to generate consumption. So if we can go to the next slide, please. So besides having lead-free stores and lead-free restaurants, we also have pottery fairs. This pottery fair was in HSBC premises in Mexico City. So what we do is that we take lead-free pottery to enterprises. We sell the pottery at a very reasonable price, is the price of the potters, and we also test for blood lead levels using lead care 2 units. So in 3 minutes, the people can know their blood lead levels, and they can buy lead-free pottery. We want to promote a very nice tradition. We don't want to go against it. We just want it to be lead-free. We want New York to be selling a lot of Mexican pottery, but of course, without causing any troubles. We don't want another case of five people intoxicated due to lead. We want the case of a lot of pottery being sold in New York and all around the world. But this will only be possible if it's lead-free. But for this, we need a lot of allies. So if we can go to the next slide, please. So we know that we have a big challenge ahead of us. Clarius Foundation has been behind of us. A lot of funders, European Union, HSBC, Promotora Social Mexico. We have a lot of donors that have seen the importance of what we are doing. Between 3 and 4% of our GDP is lost due to lead. So we generated the Lead-Free Food Alliance. So we are looking for enterprises, institutions, NGOs, and people that are solidar and that are responsible and active. And what they are going to earn is basically to remove lead from a tradition, remove lead from children. So on October last year, on the Lead Intoxication Prevention Week, we launched this alliance. So far, we have 20 institutions, including government, enterprises, restaurants, and different institutions that are joining in through 4 different challenges. The challenge is to find and act, to find children that are exposed to lead and remove the source. Another challenge is to map how pottery is being moved around the country. The 3rd challenge is to promote the selling of lead-free pottery. And the 4th challenge is to support us on our work, helping the potters to go lead-free. Right now in Mexico, you may wonder, is there a norm? Is there a legislation to prevent this from happening? There is a law, but it is not enforced. And so what we are doing as a social society, we are helping to demonstrate how law can be enforced, how this is something possible, how this is something that it's really not that expensive and that can help us economically on the health side, on the culture side. And if we are able to remove lead from pottery, we can be selling this very nice pottery all around the world, make our ancestors proud, and make ourselves pride to say that we removed lead from a tradition, and we kept a very nice tradition that makes us very proud. And the last slide, please. If you want to contact us, you can write me an email directly, or you can WhatsApp me at daniel@pureearth.org, and that's my cell phone. It's in Mexico, so it's +52 before. You can WhatsApp me, and here you can see very proud artisans that have a new kiln where they can make the production. Thank you very much.
Thank you so much, Danielle. This series of presentations has been really, really interesting, and I see there's a lot of questions in the chat, so we're running a little bit behind. If you can stay for questions, please do so. We can clearly see that the issue of contaminated cookware is definitely a growing problem, with evidence of exposure risk from a really wide range of countries. Where the people are domestically exposed through the consumption of the products, through the creation of those products, and through bringing those products with them when they leave their home country or when they go and visit as tourists. I'm sure we're all going to go home and get those lead checks and test any of the products that we have brought home from our travels abroad. Dr. Jorge's work was really important, showing that New York City as the melting pot for the world is kind of this canary in the coal mine in terms of this issue. We're having more and more stories in the media and others coming around on this. And so there was a quick question to kind of get us started, which is, and I'm not sure who is best placed to address this, but do we have really any idea of the extent of contaminated cookware globally? And especially there's a question around the extent of the use of lead glaze in pottery globally. Perhaps Rich or Dr. Jorge, you'd like to tackle that?
I'm happy to give a few non-specific thoughts here. The unfortunate truth is that we really don't know. We probably won't know until we've done more work in more countries and looked at the results from the rapid market surveys to see how many places we're finding both aluminum pots and glazed pottery in different countries. There are the anecdotal responses we get is that it shows up in many countries, but usually in specific geographies, as we can see in Brazil. But I think we just have to wait and see what the extent of this as a global exposure really shows up to be. Armin, did you have any more thoughts? You've seen it from other countries, Mexico.
Yeah, I agree with you, Rich. I think quantifying it is what illustrates impact or the extent of exposure, but not everywhere is not necessarily quantifying. But what we can see are that there are these types of products out there that can contain lead glazing, and just basically identify this as a risk factor and kind of go from there.
Thank you both. A question for Dr. Matthey. How do you quantify the level of lead from the pots? What is the method or standard that you used?
I think Parameter posted a link to the US EPA method. So that's generally what we use.
Thank you. Dr. Menendez-Filho, there was a question in the chat box about how widely are the pots that are lead contaminated in Maragogi Pinho distributed throughout Brazil, if you know. You're on mute, sir.
Yes. Okay. Well, it's not spread throughout Brazil very largely, and only in Bahia. Well, most of the restaurants that serve typical Bahia cuisine, Bahia meals, they use these potteries and that may have some lead glazed. In Brazil, it's not that much, but some major stores, they buy other products that glaze, like the small pigs to save, for kids that used to save money over there. The name for it, I just missed it. But well, since the kiln where they burn this lead glaze, they have the cross contamination, and these other like crafts may have some contamination, but not as much as the glazed ones. Okay, so there must be other kind of cross contamination as well. So it's not that much used to serve food in regular restaurants throughout Brazil on this ceramic. It's more typical in Bahia and also in some places in the northeastern Brazil.
Thank you. A question for Danielle on how would restaurants, stores, or others dispose of their lead-containing pottery? And I think this is relevant given that we saw in one of the presenter slides the image of broken pottery on the beach or lakeside.
Yes, this is a very interesting question. Unfortunately, we don't have like how to dispose them properly. Of course, pottery is not such a big problem as only if you are preparing food on it. This is the only way that it will leach out. So usually it goes, if it's broken, usually it goes through the traditional waste system. What we promote is either to use them for decoration, because this is no problem for the user, and another alternative that we have seen very frequently is to use them as pots for plants. So they just drill holes and they plant on them.
That's an excellent suggestion. I actually use my lead contaminated pot from Ecuador for pens and things. So there are multiple uses for pottery, so good. I think that might be all the questions we have time for today because we are running over. There have been many other questions. Please feel free to reach out directly to the presenters to answer those questions. Again, it has been recorded and will be available on our YouTube channel, which I think will be linked to our globalleadforum.org website. So please do take a look. We'll have another session in about a month's time. So stay tuned for more news. Please share the network widely. And we look forward to also developing a way for us as a community to be able to engage a bit more easily with questions to experts and things like that. So thank you all so much for your time. And we look forward to seeing you next time.